Buenos dias, I'm here once again for another video, but today's video is going to be different. We're going to share a story. I'm Tony Montuno, and this is my cancer story. Well, a friend of mine asked me to share my cancer story. I was diagnosed with stage 3 Hodgkins lymphoma last May 25, 2020, and I found out I had cancer by accident. I was first admitted last March because I was suffering from on and off fever, night chills, and terrible cough. At first, the doctors found out I had pneumonia and decided to send me on isolation and test me for COVID-19. Well, my test came back negative, but my cough and night chills just won't go away still. So another doctor, since I kept on complaining with her about my lumps over here, the big lumps over here, suggested that I undergo a CT scan. She explained me the process that I'm going to undergo, and that's it. The CT scan results revealed that I had a big lump, a size actually of a newborn baby, the head of the newborn baby. That's between my heart and my lungs. That's protruding over here. That's why there's a lump. There used to be a big lump over here. And she told me she just want to make sure. That's why she's asking me to undergo a surgery, a biopsy actually. So 2 days after my CT scan, I had this biopsy. The whole process was crazy because I was wide awake and I was joking around with the nurse, with the doctor, and literally laughing my ass out inside the operating room while the process was going through. I know what he's doing. I can hear him ask things but can't feel the pain. I even asked to take a look first about the things he's been asking the nurse. And the doctor was friendly. He's a friend of my uncle. That's why he's nice to me. And the biopsy result came 2 weeks after. And that was the big reveal. My oncologist broke the news to me in pieces. And my first reaction when he told me that I had stage 3 Hodgkins lymphoma was weird. I asked him, am I going to die? But I was laughing. I wasn't crying. I was laughing. Which, you can see his reaction was like a question mark. Are you playing a prank on me or are you dead serious? I told him, I'm like this. I would initially laugh before I cry. That's just me. The weird me. So my oncologist explained to me about the 16 chemotherapy cycles that I am going to have. So I am on my 5th. So I'm down with my 11. Well, so far so good. My post-chemotherapy experiences mostly okay. Well, I'm going to share to you about my first chemotherapy. My first chemotherapy was weird. I can remember my dad coming into my room carrying the image of Padre Pio, and my friend bought all these sorts of juices ready for me. According to her, that after chemotherapy I would drink everything, but I did not because those are not fresh juices. Those are canned juices. And remember, my IV was covered with black cloth. That's all I can remember so far. But the weirdest part was my post-chemo. After I had my first chemotherapy, my hemoglobin came crashing. That's why I needed a blood transfusion. Well, before I had the blood transfusion, that was the funniest part of all. I had this big notice argument with my oncologist and with the nurse because I was not giving my hands. Because I kept on asking them the weirdest question. What is the complexion of the donor? I mean, I should have asked who gave me the blood, but I was more concerned with the complexion. It's a personal thing. I hope everybody would understand with that issue. And then, but eventually I gave in. After a few minutes, I gave in because do I want to live or do I want to die because of what I kept on asking? So, eventually I gave in, but really, the blood transfusion process was painful. So, it was my first blood transfusion. That's why maybe all those questions my oncologist said. But he also warned me about the possibilities because I am having my chemotherapy. Not everybody, according to him, loses their hair. But I'm starting to lose mine. So, that's my first chemotherapy experience. My second, third, and fourth was done in another hospital. They had this cancer unit where you can just go there and sit on the lazy boy and stay there for 2 to 3 hours for your chemotherapy. Well, the nurse who constantly attends to me say that I'm the weirdest patient because she never had encountered a person having stage 3 cancer who could still laugh and who could still crack a joke and be still naughty, makulit, like me. I'm still that naughty person. I don't know. After my birthday this year, or before my birthday this year, something happened. Maybe what happened turned me into this cheerful me. I used to be grumpy, but all of a sudden I became this little Miss Sunshine to some people, not to everybody, but to some people, those who are close to me. Something touched me, something hit me, perhaps, but I realized having cancer is not bad at all. Because if it's not bad at all, maybe I could have died. But God gave me this chance, a chance to survive. That's why there's this chemotherapy. Although not everybody survives in chemotherapy, but I know I will. Because He's there for me. Among the patients on the cancer unit, I'm the weirdest kasi. Most of them, while having their chemo, they're asleep. While me, I'm wide awake, playing games or listening to very loud music on my headphones, and the nurse would always say, your music's so loud, you may not be able to hear us of what our instructions would be for you. That's why we are not sleeping, because the volume of your music's loud. Try to get some sleep, keep on reminding and I would like smile and joke around and say, I don't want to sleep, I can hear them snore, I don't want to snore. I don't know. Basically, cancer has changed me and made me smile a lot. When I received the news that I had cancer, a lot of things happened to me. My dogs are noisy. Well, a lot of things happened. A lot of things changed. Some people came back. My parents became friends. For the first time in so many years, they are civil. Either for me or for the situation. And maybe that there's this one person also who came back and made me this cheerful and happy me, and taught me that there's more to life than being grumpy, to be thankful. That there's something more things to look forward to, like my cancer journey. Well, having a cancer is not, it's difficult. You have episodes of pain and some good days and bad days. Well, I already lived a year with these symptoms, and perhaps maybe I'm getting used to. Before finding out I had cancer, the symptoms were night sweats, losing weight, excessive losing weight. Because there's really more to life than being grumpy and sad. We should at first be thankful. Well, having cancer is not bad at all. People with or without cancer have good and bad days. I also have those. I have those episodes actually. Good and bad days. Well, I've been living for a year with these symptoms already. The symptoms of Hodgkins lymphoma is obvious. you lose weight, unexplainable loss of weight, loss of appetite, and you are tired most of the time. But I ignored those symptoms because I thought they were different. I was just having a high sugar. Everybody thought I had high sugar in the classroom. Because I kept on blaming my teachers for my weight loss. Studying low is no joke. Low is low. So, basically, true enough, there's more to life than being grumpy. I'm still grateful and thankful with God because without that cough and that chill, I would have gone to the hospital and had myself admitted and tested for all those clinical tests and found out I had cancer. So basically, I didn't blame him for giving cancer, though at first I was blaming my professors because they had given us tons and tons of cases, and I thought those cases made me weak. But wala eh. This is it. Well, I already had cancer, going treatment, and I'm on to my 5th chemotherapy. Well, I plan on updating you with all my chemotherapy cycles. I would love to video my chemotherapy sessions, but there's a law, hospital rule that prevents me from doing so. But I can take pictures, maybe videos alone without the medical staff because that's prohibited. But I would insert some pictures in the video for you to have the glimpse idea of what I went through. Well, guys, that's all for now. Please be generous enough to click the like and subscribe. Don't forget to subscribe, please, guys. That would mean a lot to me. And until the next video, please keep safe. Take care. Bye.